Good afternoon. My name's Maddie and I'm a student nurse from the university. I'm here for the shift handover.
Hi Maddie, I'm Anna. Take a seat.
Thank you.
We've had a really busy morning. I'll be looking forward to going home. Is it still raining much outside?
It was bucketing down when I got off the bus.
Lucky I brought my big umbrella then.
Yeah.
Right, I'd like to tell you about all the patients on this ward, starting with bed 1. John Smith is a 45-year-old male who had a motorbike accident on his way home from work. He was admitted to the ED at 2300 hours on the 1st of August with a frontal lobe contusion.
Sorry, I don't know that word contusion. Could you please explain?
Sure, in this case it means a concussion.
Thank you.
He has breaks in his right arm and hand and has had surgery including metal plates inserted into his arm. He also has deep grazes on his left knee and ankle and stitches in his right hip and shoulder.
Stitches in the right hip and shoulder?
Yes, that's right. All dressings have been changed this morning at 900 hours. He's on a self-administered morphine drip and he's also on an antibiotic drip. He has had injections to prevent blood clotting and his pain is quite manageable with the medication he's on. Dr. Singh has requested that he stay in hospital for at least another 3 days. He needs some observation and testing regarding memory loss. His right arm is in a cast and he will need regular monitoring and a physiotherapy session later in the afternoon at 1600 hours.
Will somebody come to collect him or do I need to take him downstairs?
Jenny from downstairs usually comes to collect him. Okay. I have just checked his vital signs and John is stable with his blood pressure at 135/95, which is a little bit high, so you'll need to watch that. His other vitals are fine, his other obs. Okay, so let's move on to bed 2. Mrs. Mayhow. Mrs. Mayhow is an 82-year-old female. On July 26th, she had a fall and broke her left hip as she was getting out of the car. She was admitted to the ED and had surgery and metal plates inserted. She was off morphine yesterday and has had 1 Panadine Forte every 4 hours since. Her last one was at 1200 hours. Her blood pressure is fine, her temperature is normal, her mobility is still limited though, and she needs assistance with her morning shower. She could go to the bathroom by herself, but we need to watch her and ask her to slow down. She often forgets that she's just had surgery.
I'll make sure she has help.
May also doesn't like the hospital food, and so her family regularly bring her meals from home.
What a lucky lady.
Yes, she is. Also, she likes to read a lot at night, but we try to turn the lights off by 2200 hours so that she gets enough rest to recover.
Of course.
Dr. Ellis has requested that she be in hospital for at least 2 more days. She needs to complete her initial phase of physiotherapy. Craig from downstairs will come and collect her at 1400 hours.
Okay.
All right, we'll finish the other beds out in the ward as I need to get going soon.
Okay, thank you, Anna.
You're welcome, Maddie.